My personal philosophy for treating patients is to treat everybody the same. And so I see a ton of different patients of different races, different genders, different socioeconomic backgrounds. And my big thing is that every single patient that I see is treated the same. I'm a shoulder and elbow specialist with a heavy emphasis on the shoulder side. So the majority of my practice are patients with shoulder problems, things like rotator cuff injuries, shoulder arthritis, and then younger athletes that have shoulder dislocations. That probably makes up about 90% of my practice. We always work to try to treat people non-operatively first, and then surgery is always the last resort. I came to university hospitals because I wanted to be at a tertiary care center, so a place where the most complex cases get sent. As a shoulder specialist, a lot of the patients that I see are patients that have seen other people either in the community or sometimes in other states that have had shoulder problems and haven't been given a clear solution. And so being at UH allows me to see these complex cases that help people when they're sort of at the end of the line, and being able to work with multiple different teams and other subspecialties to be able to provide good care for people with hard problems regarding their shoulders. What makes a good day for me is being able to be around good people, and that's why I chose to work here. Being in the OR with people I like, having good conversations with patients. That's what it's all about for me. It's just being surrounded by good people.